I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, when you think of plastic surgery, what comes to mind? Is it a high-priced procedure in Beverly Hills for a movie star? Well, plastic surgery is actually a pretty broad field that not only includes cosmetic and aesthetic surgery, but also surgical repair of congenital deformities, post-surgical reconstruction such as breast surgery, and hand surgery. Our guest today is Dr. Albert Harris. He is a plastic surgeon at Mayo Clinic Health Systems. Dr. Harris, thanks for joining us today.
Thanks for having me.
Well, let's begin by talking generally about your field, the field of plastic and reconstructive surgery. Tell us a little bit more about it.
So plastic surgery is the medical specialty where we use surgery to try to restore form and or function. It dates back to World War I when soldiers were injured in the field and general surgeons would try to do surgery to restore what was lost or injured in the battlefield. Now it's become a very prominent medical specialty where we do somewhere in the realm of 15 to 20 million procedures in the United States last year alone.
Wow. Well, specifically with your practice, what types of procedures do you do?
I do a broad variety of procedures. I work here as a general plastic surgeon, meaning I cover pretty much head to toe. I did do specialty training in the field of hand and wrist surgery, so I do like to do procedures that involve the hand and wrist, but I also cover breast reconstruction or other types of breast surgery. I take care of skin cancer, and I see some traumatic injuries in the emergency room.
And then also the cosmetic and aesthetic surgeries too.
And that as well, yes.
Well, as a hand and wrist surgeon, and you mentioned it that you do have extensive training in that, what types of problems with the hand and wrist do you help patients with? I guess most folks probably wouldn't think that a plastic surgeon would help someone with their hand or wrists.
You're absolutely right. Most people think of their orthopedist when they think of hand and wrist surgery, but really both orthopedists and plastic surgeons do many of the same procedures. I can treat broken bones in the hand and wrist equally as well as an orthopedist, and then we also take care of some of the soft tissue injuries such as tendon injuries or tendinitis. We take care of nerve injuries and nerve problems like carpal tunnel. And then we also deal with some of the congenital things. If a child is born with too many fingers or not enough fingers, we can take care of that as well.
And one of those things would be a reconstructive surgery, I would imagine. So what are some of the other reconstructive type surgeries that a plastic surgeon does?
Well, again, as I mentioned, we go from head to toe. So some plastic surgeons specialize in pediatric care, and they will do things like cleft lip or cleft palate or restore children whose skulls have not formed properly. We'll also do reconstructive things for a bad trauma, such as like a car accident or a war injury, where people have lost or severely injured or damaged some part of their body. And then we do cancer reconstruction. So that can be something as simple as taking a small skin cancer off to something like breast reconstruction, where we recreate a breast after we've had to remove it for cancer. And also we do other types of tumors throughout the body.
So a lot of different procedures.
It's one of the things I like about plastic surgery.
Well, let's talk about cosmetic surgery now. What are some of the most common types of cosmetic plastic surgery, and please describe them?
Well, in the United States, the most common cosmetic surgery as of last year's numbers is a breast augmentation. Probably about 300,000 breast augmentations were performed last year, and that's where we enlarge the size of the breast either with an implant or with some of your own tissue. That's probably the most common, but also we do things like a tummy tuck, where after pregnancy, if there's loose or excess skin, we remove that surgically. There's liposuction, where we remove unwanted deposits of fat throughout the body, including the head and neck or the hips or thighs. And then with the growth of bariatric surgery, where they do surgery to help patients lose weight, those patients are often left with excess skin in several parts of the body, and we do surgeries to help remove that excess skin and help them improve their shape.
And you mentioned breast augmentation being the number one cosmetic procedure, there's also breast reduction and breast lifting too, correct?
Absolutely. Breast reduction doesn't really fall under the cosmetic realm. It can be, but often that can be an insurance-based procedure, because oftentimes women are wanting a breast reduction because they're having pain in the back or neck or shoulders. But also a breast lift kind of falls somewhere in between, where it's not the size of the breast that's the problem, but the position.
And breast augmentations, there are saline implants and silicone implants. What's the difference between the two, and is one better than the other?
The difference between the two is really what's inside the implant shell. The implant has a shell that's the same whether it's saline or silicone, and then what's inside is either silicone or saline. Saline is basically salt water, so those patients that get those implants don't have to worry as much about rupturing the implant or injuring the implant, because it's really just filled with water and it's not harmful. There was some concern a number of years ago about whether silicone was harmful to have in the body, and for a period of about 10 years or so, the FDA removed silicone implants from the United States, and they weren't available. Since that time, studies have been done and shown that silicone is safe to have in the body, and I would say now that silicone is probably the predominant type of implant used for both breast augmentation and breast reconstruction. In terms of what's better, it's a matter of opinion. Some surgeons like saline implants, some surgeons prefer silicone. I try to talk with the patient about the pros and cons of each and let them decide.
Great. Let's talk about some of the non-surgical options for lines and wrinkles, and how they help with things like crow's feet, forehead furrows, and frown lines.
Sure.
What are some of the non-surgical options?
There are a variety of non-surgical options to treat facial wrinkling or aging. And I would say, technology is advancing rapidly, and there are always new procedures to help these things. Probably the most common one here in the United States is Botox. A lot of people are familiar with it. What it is it's a toxin that's used to target specific muscles and paralyze them to prevent those muscles from creating wrinkles. That's a very effective method of treating certain wrinkles, but not all. So in order to complement the Botox, certain fillers have been designed, and what they're gels or liquids that we use to plump up the face to try to dissipate the wrinkle, to restore some of the volume that's lost in the face as we age. And then finally, there are other methods such as dermabrasion or microdermabrasion, laser treatments, and chemical peels, which basically try to remove a thin layer of the skin to help tighten the skin and decrease the wrinkling.
And all of those procedures should be done by a plastic surgeon?
For some of the non-surgical methods, they're done by a variety of different doctors. Of course, if you ask a plastic surgeon, I'm going to say that yes, a plastic surgeon should be the one to do them. But dermatologists are capable of doing a lot of these things, and certainly competent to do some of these treatments as well.
Now, you said Botox is a toxin.
It is.
So when I hear that you're injecting a toxin into someone, that doesn't sound good. Are there risks associated with this, or is it perfectly safe?
No, there are certainly risks to all of the things that we do in plastic surgery, and some of the risks are small and some of the risks are large. Certainly, Botox as a toxin, if it's used inappropriately, can lead to some serious complications. In the right hands, it is very safe, and most of the side effects that occur, or the bad things that occur, most of them, much like the Botox, are temporary side effects.
And how temporary is Botox? Is it things like dermal fillers and Botox injections? Are they things that you need to repeatedly come back to the doctor to have done again?
All of the non-surgical methods of treating aging, like Botox and fillers and dermabrasion, they all are temporary in a couple of different senses. Botox itself, it lasts for about 3 to 6 months. And the fillers, we find, they last anywhere from 6 months to 1.5 years, but they do need to be repeated in order to maintain their effectiveness. but also we're fighting a constant process of aging, so that too is something that's going to require treatment as we continue to age.
Cosmetic surgery can help improve your appearance, but it's not for everyone. Any words of advice for someone who is considering cosmetic plastic surgery?
I think the first thing that I would do is search out a board-certified, trained plastic surgeon. One of the ways you can do that is go to the American Society of Plastic Surgery or ASPS website, and they have a listing of who's certified by the American Board to perform plastic surgery. And I think that's an important first step to make sure that your surgeon is well trained and safe. But then there are other things to consider as well. One is comfort with the surgeon that you have. Two is to establish reasonable expectations, I would say, to make sure that what you want is something that your surgeon can provide for you. Then there's, of course, the issue of cost. Cosmetic surgeries are generally not covered by your insurance, and so there is sometimes a out-of-pocket cost to you, and that can be quite high for certain procedures. And then finally, I guess there's the recovery. It is surgery that you're undergoing, so like any surgery, there is a recovery time period. For some, that will be a few days, but for some of the larger procedures, it may be a few weeks to even months.
Are many plastic surgical procedures covered by insurance, and is that something that a patient needs to make sure that they're aware of?
Most plastic surgery procedures are covered by insurance. Certainly the cosmetic ones are not, but that really only is a small portion of what we do. The insurance will cover most things if they're not for the simple improvement of your appearance. We don't expect the patients to know what's covered and what's not. We know what's covered, and we can tell the patients when they call to make their appointment. And if it's ever a question, we can always contact the insurance company and make sure that their procedure is covered before undergoing surgery.
So something, say a reconstructive procedure like a breast reconstruction, or someone who's had trauma and has reconstructive surgery, for the most part, those are covered by insurance.
Yes, those are what we call medically necessary procedures. Mm-hmm. So the procedures are necessary to restore form or function, like I mentioned before, and so those are almost always covered by insurance.
When it comes to plastic surgical procedures, are most of them same-day surgery where a patient is in that morning and out that day?
I would say the majority of them probably are, but it depends on the procedure and what we're trying to do. Some procedures are quite extensive and can require a lengthy hospital stay of several days to even a week. Some of the smaller procedures are outpatient procedures that you'll go home the same day.
So if someone is considering plastic surgery, how do they go about making an appointment with you, the plastic surgeon? Is it something that they need to get a referral with their primary care provider, or can they just call directly and get an appointment with you?
For most things, you won't need a referral from your primary care doctor. It really is dependent a little bit upon on your own insurance, and if your insurance requires a referral. Obviously, for the cosmetic things that aren't covered by insurance, no referral is needed. You just need to call and make an appointment. For the other things, it's probably best to check with your primary care doctor first, and also to check with your primary care. I would recommend checking with your primary physician before thinking about undergoing any surgical procedure, just to make sure that your health is well maintained and that you're healthy enough to undergo such a procedure.
Great. Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Dr. Albert Harris, Mayo Clinic Health System plastic surgeon, for joining us today. Thank you very much.
Thank you for having me again.
Have a great day, everyone, and be healthy.